Well, good afternoon. Thank you to NIAA for inviting me and including me in this symposium. We certainly appreciate the efforts that NIAA has done in terms of bringing folks together on this important issue over the years. I realized when I actually saw my proposed title in print in the agenda, I realized I should probably clarify something right up front. In terms of defining goals and objectives, which is clearly important, the primary intent of my comments or talk this afternoon is not to actually define those goals or presume that I would define those goals and objectives, but primarily to get that issue on the table and to kind of focus on the fact that given the theme of this symposium on stewardship, given the discussions that occurred in the prior session on metrics, that it seems important that we maybe pause and make sure that we are putting enough time and energy and focus on making sure that we're all clear on what the goals or objectives or what the desired outcomes really are and what is our sort of destination, so to speak, because that may help us quite a bit in terms of how we coordinate and making sure that we're all kind of rowing in the same direction, so to speak. So with that in mind, I guess there were several different topics I was going to try to touch on. One, just some things that I think many of you already know, but I think it's worth saying that when we're talking about stewardship in veterinary settings, there's a number of factors that we need to keep in mind in terms of how do we kind of sort through all those issues. Clearly, the crux of my comments today is on this issue of what more may we need to do in terms of clarifying what the goals are or objectives are, kind of where we are to date, and then kind of how do we monitor and some of the issues that have been raised in terms of monitoring our progress as we move forward. So first off, I guess, I think for us to start talking about implementing stewardship or strategies intended to foster stewardship, I think there's important that we look at, particularly if we're focused on veterinary settings, that we have a number of challenges that we need to keep in mind, and as we think through that, clearly we're dealing with a wide variety of animal species that involve, particularly in animal agriculture, a wide variety of husbandry practices and settings, and then clearly quite a spectrum of stakeholders that have a role to play, and how do we bring all of those together in terms of coming up with strategies that have a shot at being effectively implemented. So first off, again, it was alluded to earlier that certainly in the veterinary sector, or we have many different species that we need to focus on. In the spirit of the One Health idea, I think the notion is that when talking about this issue, that we need to look at all the different uses and all the different settings, whether it's in the various human healthcare settings or whether it's in the various veterinary settings. Here we're dealing with not only food animals, the major food production species, which we have to deal with situations where you have very small operations, very small numbers of animals in local farms that are in some cases just hobby farmers, everything all the way, and 4-H'ers all the way up to multi-state integrators, and then sort of everything in between. We have minor species, a variety of the list goes on in terms of the different species, including things like fish and honeybees, where again, another food species that we sometimes don't think about, where there are places or situations where antibiotic use is important. And then clearly, obviously, companion animals is an element that we also have to pay attention to in terms of Are there things we need to be doing there? And then the numbers of various species can go on and on. But the point is that we need to be cognizant of all these different settings when we're thinking about stewardship. And then, particularly looking at the animal production or food-producing animals, clearly animals are raised in a wide variety of different settings. Again, and that was mentioned earlier, how do we factor that into the strategies that we are thinking about related to stewardship? Clearly inherent to animal production is the fact that we're raising and rearing animals in large groups that may be, on the order of a pen, a building full of, may have 30,000 broilers, to animals raised in pastures, to a variety of different settings where we have to manage disease. And so antibiotic use becomes important as an important tool for not only treating sick animals, but again, given the settings and the risk of disease outbreaks, that they're important tools for helping us to prevent disease and control disease outbreaks. And how can that be done appropriately and judiciously? Again, from FDA's perspective, we do recognize that antibiotics are not only important for treating disease, but they're important tools for preventing disease as well. But we need to make sure that we're, establishing strategies and approaches for using those drugs to prevent disease in a way that optimizes their use and targets the use as much as possible. When it comes to the size of these different operations, I think that's another factor that, and sometimes it can be misleading. It's not always the outcome that you think, and the tendency of small, farms is not necessarily always better. While small operations may have lower densities of animals, in some cases those particular operations may not have perhaps as rigorous controls or biosecurity measures. Whereas, say, large facilities clearly have much higher concentrated animals and certainly a lot of challenges to deal with those higher densities of animals. But on the other hand, in some cases, they actually have better controls in place or more strict biosecurity measures that can help control disease. So there's a whole variety of different factors that we obviously need to be paying attention to. Oops. And so clearly, the issue of sort of who, the various stakeholders is, and the reason I sort of point this out is the fact that when it comes to stewardship, it's really something that requires a collaboration across all the variety of different stakeholders that have a role to play in the different settings where we see animals being raised. And it's therefore important as we start talking about stewardship and identifying the goals and objectives with establishing certain priorities around stewardship, that we make sure that we bring these different stakeholders along as part of that process, because in order for us to effectively implement these at the level of the actual farm or producer, that we need to have all these folks involved in that process. So turning then to this notion of goals and objectives, I think clearly for, I'm sure many folks here have been in many conferences and discussions around concepts of appropriate use, judicious use, prudent use, or stewardship. And there's a variety of terms that we talk about, and I think it's important that we also kind of step back and make sure that when we're all using those kinds of terms and terminologies, that that there's some common thread and that we're actually have the same notions in mind, because I think they are terms that may mean different things to different folks. So I think there is an important, that it's important that we, make sure that we are working towards getting some common understanding of what exactly we have in mind. And so, I think we've done a lot in terms of thinking about particular actions we need to take or how we measure those actions. But I think it's important that we pause and sort of make sure we're clear and on the same page in terms of kind of what the outcomes are that we're trying to attain. And I think that's important for bringing folks along for why, the sort of answering the why question. Why are we asking producers or veterinarians to do certain things or to implement certain measures? What is the goal or intended outcome of doing those things? And is there a clear and consistent message that all the variety of stakeholders that are involved in this are speaking to, or is there a confusing message? Because I think all those factors are important in terms of, the success of us moving forward. So again, we have, done a lot to talk about what things we should do, and as was talked about in the last session, what metrics do we identify or measures do we identify, to track whether whether those actions have been implemented. But I think perhaps focusing a bit more on sort of making sure we have consensus around the why part of this in terms of what are the intended outcomes or the goals that we're setting for ourselves, and trying to make sure there's clarity around goals and objectives in order for us to make positive progress moving forward. And so I think with this symposium's focus on stewardship, I guess the one sort of key message that I was wanting to convey today was putting energy and effort into focusing on, can we reach some sort of agreement on common principles related to stewardship? What does that mean across the different veterinary sectors? Recognizing that whether it's in these different sectors, whether it's in the various cattle environments, poultry or swine, there may be clearly different pressures that apply and different challenges within each of those sectors, and perhaps different strategies to implement stewardship in those different sectors. But nonetheless, are there some sort of common principles that we're sort of rallying around in terms of sort of defining the goal in terms of what we're shooting for? So graphics is not necessarily one of my strong points, but part of the reason I wanted to put this up was just sort of to me, giving sort of this notion of, direction, target, that there's a destination. And I think that when we talk about stewardship and all the things that we're trying to do in terms of adjusting practices and behaviors, that, clearly it's important that we keep our eye on the ball, so to speak, in terms of what the desired outcome is, which is we're doing all these things with the notion in mind that we're trying to slow, or mitigate resistance emergence. The reality is that we probably can't prevent it, we can't stop it from happening, but there are things we can do to slow it down and to manage it. And I think that's, an important notion to keep in mind, but also that when it comes to us looking at, not only our goals and our targets, but also the measures or metrics that we're identifying, that we don't lose sight of the fact that we're doing these things, and that the things we're doing are in fact meaningful to help chip away at that ultimate goal of slowing resistance emergence. So again, just putting this idea out there, and again, my intent here is not to necessarily say that this is how we should define things, just as a way of sort of illustrating the fact that, can we focus in on some key ideas? In other words, what does antibiotic stewardship really mean? What are the core goals that we're trying to focus on within that concept, with the intent being that if we implement those goals or objectives, that they collectively help us slow down resistance emergence. And sort of in a very simplistic way, one way of thinking about it is, and again, this part of this gets to sort of clarity of message. And are we speaking with one voice in terms of when we're talking to different stakeholders, when we're talking to the general public about what it is we're doing and why are we doing it? And so, in a very simple way, is stewardship, and this is sort of a question, is it really simply the notion that, we only use antibiotics when we really need to use them? And when we find we need to reach for an antibiotic, that we optimize how we use that drug. And sort of is that it, sort of in a nutshell? And if in fact that is it, or some variation thereof, then what are the things we can do to help support those basic ideas? So I guess that's sort of an idea just to put out there, is that, again, around the message of, can we distill this into a clear message of what our goal is, and sort of put some ideas on the table that, there's some consensus around. Yes, that makes sense that that's what we're striving for. And then we sort of work to identify further details around, how do we support those ideals. So again, this is just meant to be for illustrative purposes. If you sort of take that a level further, and think about those sort of two basic ideas at the top, meaning that, in one respect, we're looking to do things that help us, support the idea that we only really, that we use or we minimize when we use antibiotics or when antibiotics are needed. Because it does seem, as just the basic principle of stewardship, that fundamentally not reaching for an antibiotic at all is really a good way to, limit, and be judicious about using an antibiotic. That are there other things we can do to manage a particular disease, through a variety of different strategies that helps meet that goal, recognizing that ultimately we may still need to reach for that antibiotic in certain circumstances. So again, some of the things that we're already working on in that arena, and that's some of the logic and idea behind why we think veterinary oversight is important, is that they're making sure that expertise is there in that decision-making process. Do I really need to reach for an antibiotic or not? And I think a veterinarian can play an important role in helping advise producers on that idea. Certainly was the idea when we initiated action under the current strategy to eliminate production uses, is that I think in the end we don't really think we need to be using particularly medically important antibiotics for that kind of purpose, because they're not really being used to manage a disease. So is that really necessary that we be reaching for antibiotics in that case? So it's really those kinds of ideas or other things we can do to more effectively manage disease and reduce incidence of disease. And again, some of these are issues that go beyond, different stakeholders clearly have a role to play. But again, that these actions and these different actions have a certain outcome that we're trying to shoot for. And whether it's, putting in place more rigorous or looking for alternative disease control strategies, whether it's, are we maximizing the way we're using vaccination or vaccination programs? Is there more that we need to be doing to try to look for and develop more effective vaccines, or other strategies in terms of how animals are raised, or how we're using diagnostics and other things in terms of deciding when an antibiotic use is really necessary or not. And then on the other side, of course, is when we do need to reach for an antibiotic, are there things that we can do to make sure that we're sort of optimizing that use? Now, maybe that's not the best word, but it's the notion that, and again, I think Dr. Braden mentioned it, it's sort of that notion of the right drug, the right dose, for the right indication. And that is there more we can do there? And certainly some of it has to do with some of the things that we're doing at FDA in terms of looking at the products, the labels of those products, what are the use conditions on those products, and are there improvements or enhancements that really need to be made there? But then this goes beyond that. I mean, it's, do veterinarians, do veterinary students, do others have the training and information they need to help them utilize these drugs, in sort of an optimal way? And again, there's, intended outcomes. What are the intended outcomes of those actions? The sum of which is sort of the intent being, down in that bottom right corner, is that these things ultimately are pushing in the direction of things that are helping to slow resistance emergence. So again, there's nothing necessarily new or particularly enlightening in this slide, other than just trying to, reemphasize or emphasize the fact that, I think putting a little bit more, focus on building consensus around, what is the message, what is our goal here, and how are the things we're doing helping us move towards and attain that goal. And when it comes to the idea of metrics, then what are the kinds of indicators that we need to be tracking to help tell us whether we're accomplishing those different actions, which are meant in sum total to help us combat antibiotic resistance. So clearly there are some things, and I think the good news is I think we are making some meaningful progress moving forward. I think some of the ways I kind of look at it that we've been up to this point anyway, kind of focused in three areas, at least I'm speaking from kind of FDA's perspective. Activities or things that we're doing that are focused on the products themselves, meaning the antibiotic products, the medically important antibiotics. Are there things we need to do relative to those products to make sure that they're aligning with what we think about today as, again, judicious use or good stewardship? There's activities that are focused on sort of behavior or practices at the farm level. And I think there in that arena, we're talking about a much broader set of stakeholders that really needs to be involved in that area. And then third is the progress, monitoring progress. We need to be identifying some kind of measures, and again, I think this is a collaborative effort. Certainly, federal agencies have been looking for mechanisms by which, and we already collect some information that helps us in this regard. But I think it was mentioned earlier that, there may be opportunities that, for more of a public-private partnership in this area too, to really get at the type of information that is going to be most meaningful. So clearly, on the product side, there's to date, the focus has been on the things we've been doing under the Guidance 213 initiative, which again, I think are really important and critical steps forward. And sometimes that, I think, gets glossed over a little bit in terms of the significance of the changes that are happening under that process. And I think the fact that we've seen the positive engagement across the ag industry, not to say that there aren't some significant challenges that folks are having to contend with, but nonetheless, I think the fact that we've seen a real positive shift towards folks really looking for solutions. And as we try to move forward and meet our target of January 1 to eliminate growth promotion use and bring the remaining uses under vet oversight. But given the significance of that, I think there are still additional measures we I think need to take. We're not finished on January 1, and our goal is to sort of build on the progress we've made under the Guidance 213 process, and continue that collaborative effort to identify, are there additional things we need to do on the product arena, so to speak? Are there additional enhancements or changes or improvements we need to make in terms of how these products, the medically important antibiotics, are labeled, the use conditions, how they're being sold, distributed, and again, we've already initiated one step to just begin the process of seeking input on the issue of some of these products having therapeutic uses or prevention uses that don't have defined use durations. And again, the primary goal here is to really look at how, what are the situations in which those products are being used to control or prevent disease. We're very interested in hearing from producers about those disease conditions. How are they being managed? Are there strategies, additional strategies or that can be done to manage those diseases more effectively without necessarily using the antibiotics continuously? Recognizing that, those are important tools. The intent is not to eliminate those products as tools for preventing those diseases, but are there ways we can use them in a more targeted way? And I think the notice we put out was really just to start the process of getting that conversation going, giving input on how do we map out a strategy forward and try to identify, improvements that could be made in that arena. There are clearly, and as Dr. Murphy mentioned earlier, the Guidance 213 process is focused on the feed and water products. Our primary, I think the reason we're focused there is because of the fact that feed and water products, clearly by design, are meant to be administered to large groups of animals. So there's certainly a greater exposure potential in terms of the use of those products in comparison to other dosage forms like injectable products. So our primary, priority was to look at the feed and water products, particularly in terms of transitioning those products from over-the-counter availability to veterinary oversight. There still are and will be, as of January 1, some other dosage forms that are available, still remain available OTC. And I think we need to be thinking about, designing or developing a strategy for transitioning those products, the medically important antibiotics that are available as over-the-counter, to veterinary oversight as well. And again, no timelines yet been set for that, but I think we need to sort of have that on the horizon. That's something else we need to be working towards. And then we need to look at other areas. Are there other areas we've not focused on, like companion animals? And I think that's another area where we need to determine whether there's additional strategies we need to be focused on in that area as well. So when it comes to the stewardship or sort of behaviors or activities at the farm level, this is where I think many different stakeholders have a role to play, and it's really critical that we work collaboratively. Certainly, we've been working in collaboration with other agencies, with USDA and CDC, but clearly this is something that really necessitates that the different stakeholder groups work in collaboration with the federal agencies about what can be done in terms of designing strategies as it relates to stewardship, and because implementation is going to require involvement by the different producer organizations, veterinary associations, and others to affect change in that area. And clearly, as I noted, the challenge is how do we work across all the varied sectors and find strategies that can be applied effectively in those different settings. And certainly a lot of progress has been made to date. I would say in response to the Guidance 213 initiative, we've been very encouraged by the engagement we've seen from a variety of stakeholder groups who have been actively working to get information out to veterinarians, producers. And I think it's very encouraging by the fact that, we did set up a CVM, Ask CVM site to sort of funnel all questions in. And, the detail and the number of questions that we've been getting, it's rather impressive. And the one thing it does tell me is that people are really trying to get it right, which is really encouraging. I mean, we're coming up with all kinds of things that, we never really thought of. And that's the challenge with implementing these kinds of changes is, what do we do in this situation or that situation? But I think the encouraging thing is we've got, I don't know, we're probably up to, 300 or so questions that have come in specifically, just like, say, on the VFD rule. But I think the encouraging thing here is the sense that folks are really trying to understand it and their desire to really get it right. And I think that's important, and that's a very encouraging sign. And we recognize it's a challenge, and there is certainly a learning curve that we need to work through, and a lot of challenges to get through, as we move into the new year in January. And certainly, as it relates to stewardship, again, it certainly goes beyond the federal agencies. I mean, we've seen engagement by different academic organizations about, stepping back and looking at veterinary curricula. Is there more we need to be doing there that new veterinarians coming in to the practice environment, have additional skills or information regarding antibiotics? And even to date, we've seen the producer organizations, have incorporated judicious use ideas into their quality assurance programs. But again, I think there may be more we can do in that arena in terms of really focusing in on, again, what our primary goals and objectives are related to stewardship. So, sorry. Can't get used to the delay on this. So, again, as it was discussed in the last session, clearly, defining metrics or measures is going to be important or is critical as we move forward with all these different efforts. So as we have some understanding as to whether the things we're doing are actually having the desired impact. And I think it's clear that we need to focus and get clarity around what our goal is. I think it's, and in terms of what, success looks like. And certainly, reduction in overall use of antibiotics is not necessarily the only, the end point in mind. But we expect that, by putting an emphasis on implementing good stewardship practices, reducing unnecessary or inappropriate use, that the outcome will likely be that we're going to have an effect on reducing overall use. But the driver really is focused on, how we're using antibiotics. Are we using them? Are we using them in situations where we don't really need to use them? And when we are using them, are we using them in an optimal way? And I think the outcome of that is going to be some effect on modulating overall use, and that how these drugs are used are, the desire is that they're being used in a way that's less likely to be driving resistance. Again, are we going to prevent resistance? Not likely, but can we slow it? The goal is slowing it down. And again, we can't lose sight that that's really the goal that we have in mind, is that the things we're doing are helping to mitigate resistance. So again, my rather simplistic graphic here, but and this tying into the notion of metrics is the idea that, again, trying to keep our tethered to the idea that what we're trying to do is slow resistance emergence, but there's, which again is sort of the ultimate indicator of, are all the things we're doing across all sectors where antibiotics are being used, are we moving the needle, so to speak, in terms of slowing resistance? Clearly that's the root of it. But we really need to be identifying kind of intermediate, indicators. So if we're identifying certain actions that we think are important, again, in this model, and I'm just saying in this model for argument's sake, actions that we're taking to try to, avoid use or minimize use and limit it to only when we need to, what are those actions? And are there things we can track that give us an understanding as to whether those kinds of actions are actually being implemented? And that gives us an indicator of whether or not, if that's what adds up to stewardship, then it's a way of us sort of tracking whether we're actually making progress in terms of how we're actually using these products at the ground level. So, again, there clearly are a lot of challenges on the monitoring the impact issue. As we've already mentioned, there's quite a wide variety of settings that we have to take into account. I think it's, clearly, as Dr. Braden mentioned earlier, there's a lot of work going on within the human medical community in terms of implementing stewardship programs, tracking their effectiveness, and certainly it's reasonable that folks look at the human medical community and see, okay, we see what's happening in those sectors, what's happening in the, what's comparable, in the veterinary sector. So I think, how do we respond to that, and how do we address that? And I think some of the challenges, just reality, but the things we have to work through, is clearly the infrastructure that exists in terms of healthcare infrastructure, so to speak, is vastly different, clearly, on the human medical side than it is on the veterinary side, and certainly that is a challenge that we have to deal with, whether it's in way that things that can help support implementing standards or stewardship ideas or principles in different settings, or whether it's being able to tap into information that helps us measure or track impacts. We don't have that infrastructure, much of that same kind of infrastructure in the veterinary side. So it's certainly a challenge. I mean, I'm not saying that as an excuse that we can't do something, but I'm just saying it's a real challenge that we have to figure out how do we work through that to get at the information we need. But I think we are making progress, and certainly FDA has been working with USDA as it relates to mechanisms for gathering use information. And certainly we hope that funding becomes available that enables some of the survey work that USDA has been working on, that can move ahead. FDA recently awarded several grants, working with several researchers in academia to look at strategies for collecting use information. And in my mind, that would be a good example of, an opportunity for, a public-private partnership to gather the information we need. So in closing, again, I think significant progress has been made to date. I think the engagement we've seen from the industry is very encouraging, and we clearly have an important milestone coming up January 1. But stewardship, or antimicrobial stewardship, something that we need to be sure we sort of have clarity around how we define that, is an ongoing process and something that we have to continue to work on and really realistically move it forward in incremental steps and phasing in changes over time as those changes are determined to be needed. And again, it can't be successful without engagement of all stakeholders, including veterinary producers and others. And again, my main message for this talk was just that we continue to strive for seeking a common understanding as to what the goals and objectives are of the notion of implementing antimicrobial stewardship. So thank you.